Welcome back to our channel. Today we're discussing the findings of the CLOT trial, which compared the effectiveness of Dalteparin and Warfarin in reducing venous thromboembolism, VTEL, recurrence in patients with cancer. Let's dive into the results. In patients with cancer, Dalteparin reduced VTEL recurrence without increasing bleeding risk or deaths compared to Warfarin. Prior to the CLOT trial, standard therapy for VTEL included a brief period of heparin, followed by long-term oral anticoagulation. The 2003 CLOT trial demonstrated the superiority of Dalteparin, a low molecular weight heparin, over Warfarin in patients with cancer, reducing the rate of recurrent VTEL at 6 months without significant differences in bleeding or mortality. The CLOT trial was a multi-center, open-label, parallel group, randomized controlled trial with 676 patients with cancer and acute symptomatic VTEL. Patients were randomized to receive either Dalteparin or oral anticoagulation. The study aimed to provide a clear comparison between the two treatments in a real-world setting, ensuring the results were applicable to everyday clinical practice. Inclusion criteria included adult patients with active cancer and newly diagnosed symptomatic proximal deep vein thrombosis or pulmonary embolism. Key exclusions were high bleeding risk, recent anticoagulant therapy, and severe renal insufficiency. This ensured that the study population was representative of the typical cancer patient with VTEL, providing robust and generalizable results. Patients were randomized to Dalteparin, administered at 200 international units per kilogram per day for 1 month, then 150 international units per kilogram per day, or Warfarin with a goal international normalized ratio, INR, of 2 to 3. Folic acid was given daily to all participants to ensure consistent nutritional support across both groups. The primary outcome, recurrent VTEL, occurred in 8% of the Dalteparin group compared to 15.8% in the Warfarin group. This significant reduction highlights the effectiveness of Dalteparin in preventing recurrent VTEL in cancer patients. The results were consistent across various subgroups, reinforcing the robustness of the findings. There were no significant differences in major bleeding, with 6% in the Dalteparin group versus 4% in the Warfarin group. Mortality rates were also similar, with 39% in the Dalteparin group and 41% in the Warfarin group. These findings indicate that Dalteparin does not increase the risk of bleeding or death compared to Warfarin. In summary, the CLOT trial found that Dalteparin is superior to Warfarin in reducing VTEL recurrence in cancer patients without increasing bleeding risk or mortality. These findings support the use of low molecular weight heparin in managing VTEL in this population. Despite clinical evidence, adoption of low molecular weight heparin for VTEL in cancer patients has been slow due to cost. However, reduced high-cost care related to acute thromboses might offset this cost. Later trials confirmed these findings, showing similar benefits with low molecular weight heparin. Thank you for watching. Stay informed and consult your healthcare provider for the best treatment options. Don't forget to like, share, and subscribe for more medical insights. Your health is our priority, and we are here to keep you updated with the latest in medical research.